Welcome you all for the second part of anatomy of female pelvis, abdomen, breast and reproductive tract. So myself is Ranjani, Assistant Professor, School of Physiotherapy, Sri Balaji Vidyapath. So the last part we discussed about the female genital organs. In that female genital organs, we discussed about the external genitalia. In external genitalia, we discussed the parts of mons pubis, labia majora, labia minora, hymen, clitorius and other vestibular glands. So in that we discussed about the additional part of perineum. So in perineum there are two types of perineum. One is the anatomical perineum and another one is the obstetrical perineum. So in anatomical perineum we discussed about the boundaries and types of triangles. So that is anterior and posterior triangle. So the anterior triangle is called as the urogenital triangle and posterior triangle is called as the anal triangle. So next we are going to discuss about the obstetrical perineum. So in obstetrical perineum is also known as the perineal body and central part of the perineum. So we already discussed about the shapes of the perineum. So the shape of the perineum is the pyramidal shape. So in this region, the pelvic floor, the perineal muscles and the fascia, so three will meet together in that part of between the vagina and the anal canal. So that it is called as the obstetrical perineum because it plays the major role for the obstetrical and it measures about the 4 centimeter. So that is 4 centimeter length and 4 centimeter width with the base covered by the perineal skin and the apex is pointed and continues with the rectovaginal septum. So we will discuss about the rectovaginal septum later on this session. So next is the musculofacial structures involved in the perineum. So first one is the fascia. So in fascia, two layers of the superficial perineal fascia. So that is the superficial fatty layer. See, so there is the two things. So one is the superficial fatty layer. So another one is the deeper layer. So the deeper layer is also known as the colus fascia. So the inferior and superior layer of the urogenital triangle. So this is the second part. So this two together called the triangular ligament. So one is the inferior and another one is the superior layer of the urogenital triangle. So that I will show it in the picture. So see this burger arrangement. So first thing is the colus fascia. So that is the deeper layer. So see the second thing is the perineal space. In between the perineal space and the colus fascia, this stuff is known as the superficial perineal space. So and this superficial fascia of the urogenital diaphragm. So in between the superficial fascia of urogenital diaphragm and perineal space, there will be the stuff known as the deep perineal space. So one space is the deep perineal space. So another filling region is the superficial perineal fascia. Superficial perineal space. So this will correlated into the perineal structure. See the first structure is this is the first structure. So that is the colus fascia. So this is present on this deeper layer. So the next thing, see the superior part. So superior part is the urogenital diaphragm. See, this is the urogenital diaphragm. So this stuffed part is the deep perineal space. Deep perineal space and this is the superficial perineal space. These spaces are mostly empty. So this superficial space are very empty. It plays the surgical role. So this is the superficial perineal space and then deep perineal space. So see the green dotted line. So the uppermost part is the deep perineal space, and which is present in the superficial region is the superficial perineal space. So next structure is the muscles. So we have discussed about the fascia. So next one is the muscle. So superficial and deep transverse perineal. So these two muscles are the paired muscle. One muscle is the superficial. So that is present superiorly. So that is the superficial structure, and then deep transverse perineal. It's also the paired muscle, and then bulbospongius, levator ani muscle, that we already know about the levator ani muscle. So that is three kinds of muscle. So pubococcygeus, puborectalis, and the iliococcygeus muscle. So in the perineal muscles, it's a pubococcygeus part. So that is also the paired muscle situated at the junction of the upper 2/3 and lower 1/3 of the vagina. And the fourth one is the sphincter ani external. So few fibers are present in the perineal region. So see the diagram. So this is the perineal body. This is the perineal body. In this region, so this is the superficial, which is present most superficial. So that is the superficial perineal muscle. So this is the superficial perineal muscle. So this part is the perineum. See, this part is the perineum. So the superficial perineal muscle, and then this is the deep perineal muscle. So deep perineal muscle. And then this is the levator group of muscles. So one is the pubococcygeus, and then puborectalis muscles is also present in the perineal space. So this is the external anal sphincter. So this also present in the perineal region. So what is the importance of the perineum? So first one, it helps support the levator ani, which is placed above it. So next one is by supporting the posterior vaginal wall. It directly supports the anterior vaginal wall, bladder, and then uterus. So the next part we will discuss about the vaginal walls. So it is the third important thing is it is vulnerable to injury during the childbirth, because there will be the perineal tear, and if the surgeon will do the deliberate cutting of the region during the delivery, so that is called as the episiotomy. So this part is mostly involved in the delivery session. So next one is the internal parts of the perineum. So internally there will be the two pouches are there. So one is the utrovesicular pouch and then rectouterine pouch. So first we have discuss about the utrovesical pouch. In utrovesical pouch, anteriorly the perineum covering the superior surface of the bladder. See, this part is the vesicouterine pouch. Okay. So in that vesicouterine pouch, the covering, so the anteriorly it is covered by the superior surface of the bladder. So this is the superior surface. So this is the bladder. The topmost region is the superior surface of the bladder. So that will present on the vesicouterine pouch. So anterior to the vesicouterine pouch, over the anterior surface of the uterus. So the uterus is placed in between the bladder and then rectum. So uterus is somewhat anteverted to the bladder, so that the utrovesicular pouch in the anterior region, so there will be the part of superior border of the bladder and then anterior surface of the uterus at the level of internal OS. So see, this is the green part is the internal orifice of the uterus. So this will also play the important role of the vesicouterine pouch. So the next thing is the pouch of Dalgas or recto-uterine pouch or cul-de-sac or recto-vaginal pouch. So the peritoneum, so this is firmly attached to the anterior and posterior wall of the uterus. So see the recto-uterine pouch. So this is the recto-uterine region. So the anterior and posterior wall of the uterus. So this is the anterior and posterior wall of the uterus and upper 1/3 of the posterior vaginal wall. So this is the vaginal wall. So this is the recto-uterine pouch. So in this region, so this is the anterior. Anteriorly it will covered by the posterior part of the uterus. Right? So the upper 1/3 of the posterior wall. So it is present on the posterior side of the recto-uterine pouch, where it reflected over the rectum. So the posteriorly it will reflected over the anterior part of the rectum. So that is why it is known as the recto-uterine pouch, because it is present posterior to the uterus. So the recto-uterine pouch is continuous from the pararectal fossa. So the pararectal fossa is present between the is present anterior to the rectum and then vaginal wall. So see, this is the vaginal wall and this is the rectum. So this pararectal fossa is present in between the anterior surface of the rectum, anterior to the rectum and then posterior to the vagina. So this region is the pararectal fossa. So this is the anterior part of the pouch of Dalgas. So we already discussed about the anterior structure. So see, this is the upper 1/3 of the posterior vaginal wall. So this part is the upper 1/3 of the posterior vaginal wall. So in this picture we are discussing only about the anterior covering part. So in anterior covering part, so this is the upper 1/3 of the posterior vaginal wall and posterior vaginal fornix and then posterior covering of the cervix. So this is the anterior structure of the recto-uterine pouch. So that is the pouch of Dalgas. So this is the posterior region. See the posterior region. So there will be the structure is the peritoneal covering of the anterior surface of the rectum. So this is the peritoneal covering of the anterior surface of the rectum and laterally it is covered by the uterosacral fold of peritoneum, covering by the uterosacral ligament. So this is the uterosacral ligament. So this is the cross section of the lower abdomen. So nearly the pelvic region. So see the structure, it is the urinary bladder. So this is the cervix and this rectum. So this is the transverse cervical ligament and see the part of uterosacral ligament. So this is the uterosacral ligaments which is continuous from the uterus to the sacrum. So see the lateral structure of the image. So this is the uterosacral ligament. It starts from the sacrum and crossing the rectum and ends in the uterus region. So this is the uterosacral ligament present on the lateral aspect of the pouch of Dalgas. So this is the difference between the male and female cross-sectional image. See the female cross-sectional image. So this is the space called recto-uterine space. So the same thing is present on the male. So that is known as the rectovesical pouch. So see the structure is called the vesico-uterine pouch. So that is the anterior structure. So we discussed about the two structure. One is the recto-uterine pouch. So that is the pouch of Dalgas. So in similar For male, it is known as the rectovesical pouch. So another one is the vesicouterine pouch that is present anterior region. So there is no vesicouterine pouch in the males. So see the similar structure of both male and female is the supravesical fossa and then rectopubic fossa. So the rectopubic fossa, that is suprapubic approach to the prostate and pelvic repair through this spaces only, retropubic space. So this is the important of the retropubic space. And then rectovesical fascia. So this is also known as the Denon-Wille's fascia. So next we are going to discuss about the floor of pouch of Dalgas. So this image is the cross section of the supine lying of the pelvis. So in this view we are clearly seeing about the floor of the pouch of Dalgas. So it is formed by the reflection of the anterior peritoneum into the anterior surface of the rectum. See the yellow line within the picture. So that is the floor of the pouch of Dalgas, and it is about 6 to 7 centimeter above the anal orifice. So here is the anal orifice. So here is the anal orifice. So 6 to 7 centimeter above the anal orifice. Below the floor there is a thin fibrous tissue septum. So that is known as the rectovaginal region. So what are all the content present in the pouch of Dalgas? So it may remain empty but may contain coils of intestine or omentum. So what is the importance of the pouch of Dalgas? So first, it most depending part of the peritoneal cavity. Intraperitoneal blood or pus usually settled down to the pouch to produce either pelvic hematocele or pelvic abscess. So second one is the herniation of the pouch through the posterior fornix may occur, producing the clinical entity of enterocele. So the vaginal ligation is mostly done through the opening of the pouch of Dalgas, and the choldoscopy, choldocentosis, or at time pneumoperitoneum may be done through the pouch. So the nodules deposited in the pouch can help in the clinical diagnosis of the pelvic malignancy, endometriosis, or genital tuberculosis. So now we will discuss about the blood supply of the perineum. So in perineum, branch of internal pudendal artery and then branches of femoral artery. So that is the superficial and deep external pudendal. So veins is the internal pudendal vein, vesical or vaginal venous plexus or long cephalic vein. So see the image. So there will be the presence of the arteries. So see the internal pudendal artery. So this is the internal pudendal artery. From the internal pudendal artery, there will be the branch is the perineal artery. In the perineal artery, there are two types of, they will be divided into two branches. So one is the transverse perineal artery. So this transverse perineal artery will supply the perineal body. So that is the perineal muscles, and see the structure. This is the bulbo spongious muscle, and this another branch is going to the deep transverse muscle. So then it will splitted into the tooth. So that is the perineal posterior labial artery. So these are all the small branches from the internal pudendal artery. So this is this left side part is the superficial region, and so this right side is the deeper region. So the deeper region is the internal pudendal artery, so also known as the clitorial artery. So that will give the deep branch of perineal artery. So that will supply the deep perineal muscle. So next one is the nerve supply. Nerve supply, that is the bilateral spinal somatic nerves. So one is the anterosuperior part of the cutaneous branch from the ilioinguinal and genital branch of the genitofemoral nerve. So that is L1 and L2. And the posterior inferior part by the pudendal branches from the posterior cutaneous nerve of the thigh. So between these two groups, the vulva is supplied by the labial and perineal branch of the pudendal nerve. So the nerve root is S2, S3 and S4. So this is the nerve supply of the perineum. So next part we will discuss about the internal female reproductive organ. So just we go through about the today session. So today we discussed about the obstetrical perineum. So in obstetrical perineum we have discussed about the two major part. So that is the pouch of Dalgas and utrovesical pouch. So this two part we discussed, and then importance of the perineum we discussed. So next class we will discuss about the internal female reproductive organs. So in that internal female reproductive organs, we will discuss about the vagina, structure of the vagina, uterus, fallopian tubes and then ovaries. Thank you. We will see in the next class.